All right, everyone. I'm going to begin the next track. This is the COVID-19 track. Our next speaker is Brian Fisher, and his presentation is Alaska Pandemic Response Organization and the Lessons Learned. So welcome, Brian, and you can take it from here.
Good morning, everybody. Thanks for being here. I think we are still working on moving folks into and out of the right sessions that we're in. So if you're in the wrong room, just put a note in the chat, and the production team will help you get moved to the correct breakout room. So thank you for everyone for being here. For this next hour or so, next 50 minutes, we're going to talk a bit about some lessons learned with how we all organized for the response to the pandemic. So, I mean, I know, this particular disaster, public health emergency really affected every resident, every community, every organization in the state to a very large degree. And it's something, I like to tout that I've been with the division for 100 years, and it never ceases to amaze me how unprecedented events like this occur. So I wanted to talk with all of you and really have this more of an informal talk session about how, we'll share a little bit about how we organized at the state level with the Unified Command and in the State Emergency Operations Center, but really have a conversation with all you about how you were able to adjust in your local areas, within your agencies, to organize to manage this response. I don't think many of us were prepared really to, really embrace the partnerships that we've all had to embrace during this whole time. And of course, none of us expected that we would be at this, well over a year in these organizations. So as usual, I think there were some growing pains. I think there was opportunities for us to, to come up with some new innovative solutions for how we were all able to communicate across this vast state in a period of great uncertainty and move forward there. So if I could get my slides up, I would appreciate it. See how that works, Jeremy or the team, if I can get my slides up. Or maybe I'll put them up myself. Hang on a second. I don't seem to be able to do that. So let's see. All right, so hang on just a second, folks. I'm trying to find my presentation here right now. Oh, this isn't quite working for me. Just give me just a minute here, and we are working on moving people around to their right breakout rooms. So stand by as we get that. Set up as well. I am not seeing my presentation. So there we go. Let's see if I can get that up. So hopefully you can all see that now. Somebody give me a verbal whether you can see that or not.
I've got it.
Thank you. So just a little bit to start on our end here. I wanted to talk a little bit about how we organized at the State Emergency Operations Center and how we initially organized, and then share a little bit with my other section chiefs that are on. I think we were planning on having the other incident commanders, unified commanders on with us today, but just a notice at the top of the session here, most of you have probably already seen in the news or heard that There are some challenges with the Johnson & Johnson Janssen vaccine that are being announced this morning. So our unified command and our health team are unfortunately overcome by events, and they're in the middle of responding to that request to take a pause on administration of the Johnson & Johnson Janssen vaccine as the FDA looks at some reported cases of blood clots associated with that. So unfortunately, I don't have any more information about that at this time, but there'll be more coming out from the health team and the unified command throughout the day on that particular situation that's going on. So a little bit of background. Back in kind of right after September 11th, kind of post September 11th, 2001, we were faced with a potential threat in this country about weaponized smallpox and obviously weaponized anthrax. And to that end, the federal government had charged all of the states to develop a response plan on how to deal with those kind of instances, bioterrorism, if you will. That really evolved into all of the states really focusing on planning for a pandemic response. So those of you that were involved in that, myself included, we certainly called that our years of the pandemic, where we were coming up with plans to respond in case there was a pandemic. We had SARS and MERS. We had H1N1 in 2009, and that was 2009 was the first time we really implemented our pandemic response plan for the state of Alaska. And in that plan, at the time, Dr. Butler, who's the deputy director for infectious disease at CDC now, and myself were charged with coming up with a plan and an organization on how we were going to respond if we saw a pandemic in Alaska. And to that end, we're mostly ICS purists at the state EOC. We certainly brought our health partners into the fold to educate them on what the incident command system was and the national incident management system back then, and came up with a plan really looking at some of the instances that a unified command is appropriate. And that's really when there are multiple organizations or jurisdictions that have the legal responsibility or the resources and authority to respond to an incident. So it was pretty clear to us back then that the right way to put an organization together to manage the response to a pandemic was with the Department of Health and Social Services, who is our public health entity in the state. Our agency at Homeland Security and Emergency Management, who runs the State Emergency Operations Center and are kind of the pros at providing support, resource support, and information support to local jurisdictions during times of disaster. And then the Alaska State Troopers and the Department of Public Safety, because they have statutory roles for just that, for public safety across the state. So we had developed a plan and a theory that we were going to stand up what's called a unified command. And like I said, that's when multiple organizations come together that have responsibilities or resources to bring to the fight, if you will, to respond to a potential pandemic. We stood that organization up in 2009. For those of you that were around, that ended up not being anywhere near like this pandemic. We really entered into an exercise in medical countermeasures distribution. We relied heavily on the private sector to distribute things like Tamiflu, antivirals, and therapeutics for H1N1, and that was largely successful. So as always, the cycle of emergency management, we stood up, we did after actions and hot washes and all those things to look at lessons learned then, refined our plans moving forward, and then we come to 2020, with the news of the virus coming out of China. So at the state EOC, we stood up the EOC really, I think it was January 24th of last year, and that was to support the request from the U.S. Department of State on the potential for landing a whole bunch of repatriates from State Department employees and their families from Wuhan, China. They were getting on an evacuation flight and heading back to the United States. And we were one of the potential offload points for that operation. So we ended up suggesting that Alaska in the middle of January wasn't the best place for those folks to be their final destination. So we ended up being a refueling stopover point, if you will, with some additional screening as the plane was being refueled, and then it flew on to California, and those folks were quarantined for a small period. So we were activated in a very small mechanism there, still not in a unified command from January into the March timeframe. So our agency, the State Emergency Operations Center, the Department of Health and Social Services, the Alaska National Guard, the municipality of Anchorage, all of us really activated to some degree to manage, number one, that repatriation flight that came in, and number two, to start that aggressive planning to be prepared for the potential of that novel coronavirus indeed becoming a pandemic. And it happened. So when that was announced by the federal administration, the World Health Organization, and the Centers for Disease Control and Prevention, we met as is normally the case in the incident command system process. We met with the agency administrators from public safety and health and military and veterans affairs to have a high-level leadership discussion, delegations of authority, and an initial plan on how we were going to organize, stand up a unified command, and begin supporting you all out in the field with this novel coronavirus. So we used our plan. It's often said that plans never survive first contact with the enemy. However, we had used this organizational construct before, and we are using it now and have been using it since March, since we stood up that unified command. So if you know any of the folks that work in our organization, you could see parenthetically where we've put people's agencies that they represent here. So from the very beginning, Heidi Hedberg, the Director of Public Health at the Department of Health and Social Services, myself, and Lieutenant Paul Fussy from the Alaska State Troopers in Department of Public Safety, were identified and delegated the authority to manage the response to this. Each of our agencies brought our own unique skills and authorities to the table. The rest of this organization chart here, if you're not completely familiar with the incident command system, is the command and general staff. So we have some liaison officers. Public information is always incredibly important. A safety officer that was responsible for the safety of us in the state EOC or in the unified command. Disability integration, access, and functional needs is incredibly important to all of us, no matter what the disaster is. And I'm proud to say we have a great partner at the Department of Administration, the Division of Personnel and Labor Relations, Mr. David Newman, who's the State Americans with Disabilities Act coordinator, and was able to jump on as our disability integration advisor for this event, as well as the earthquake in 2018 and a number of other things. I am, again, proud to say we scrambled very quickly to make sure that all of the press conferences and media briefings and all that we were doing early on with the governor had sign language, American Sign Language interpreters there at the press conferences. Prior to that, we did a little bit of that with FEMA's assistance during the earthquake, but I'm really proud to see and say that we really seem to have taken that to the next level within the Unified Command during the response to this event. So just some general observations I'll share with you all. It was clear to us that many communities around the state that may not have full-time emergency managers, may not have hospital capacity, may or may not have a volunteer fire department, may or may not have a police department. Kind of every community in the state, took our lead and your lead and stood up an incident command organization. Many of them called it an emergency operations center, an incident command system structure, a unified command system structure. And I think it was amazing to see people were calling themselves the thing, we'll call it the cheese sandwich, a unified command. And not very many folks around the state, particularly in our smaller communities, have ever been trained in the incident command system or the National Incident Management System. And I think that was, it was just a testament from my perspective, sitting in the Unified Command in the state EOC, honestly, for months all by myself down there when we implemented social distancing and telework measures. It was great to see that everybody was using an organizational management system to respond to this event. And they were calling it the right thing. And, many of our staff, tend to be incident command system purists. And even with very, very little training or no training at all, we saw communities across the state, really stand up, organize, start communicating at the local level with their clinics, with their regional health organizations, with hospitals if they had them, and then communicating very effectively up to the state, looking for information, which was changing on an hourly basis for months, and then organizing to work with us to provide resource support in terms of personal protective equipment and testing resources. And obviously now we're well into the vaccine part of the response to this pandemic. So I just want to say, from my perspective, many of you may have seen that, and please feel free to drop your thoughts in the chat. Organizations were stood up. There were some, always some challenges with communication when you're working with people you're not normally used to dealing with. But from our perspective at the state, it was amazing to see kind of every community in the state really stood up, really engaged their elected and appointed leadership, and started taking the right measures. It was almost all non-pharmaceutical interventions at the beginning of this response before we had access to vaccination or other treatment therapeutics, that kind of thing. So let me switch to the next slide here. So a little bit, let's see, I think I had a poll question that I wanted to have put up, and I'm not sure who is throwing the poll questions up. If I can get some assistance with that. So first poll question I have for you all, it should be up on your screen right now. Again, I think we'll make sure that in the chat we have the information on how to connect to the live polling that's going on. Just a couple questions I'm interested from all of you. Did your jurisdiction or agency stand up an organization to respond? If you did, was it a unified command structure, or not, whether it was by title or for real? And then if you did usually utilize a unified command structure, what agencies were represented? So I only threw a few agencies out there. We typically saw those in poll question number 3 were kind of the organizations that jumped into responding to this thing, and bless all of you for doing this for so long. It's quite an amazing sustained response. So if you can see the results up on your slide, we see a pretty good number. Right now about 90% of participants, agencies or communities, 91% did stand up some kind of incident management organization. And the majority did stand up or utilize what we refer to as a unified command structure. We're about 84% right now. So thank you for responding to that poll, everybody. You can see, I'll highlight down in question 3, the number of folks that participated in your local organizations. It seems fairly typical. Your emergency folks were right at the table, whether it was whether you had dedicated emergency management staff or it was your first responder organizations like fire, police, and emergency medical services. And again, since this was a public health response, a lot of participation by local medical facilities or healthcare providers and regional health organizations. I did want to highlight, and I don't have enough great things to say about the state of Alaska public health nurses. They are often the public health folks that you rely on day to day outside of the private sector medical providers you have in your communities. And our nurses have been absolutely amazing on the front lines of responding to this pandemic and supporting you all from the very beginning. So, on behalf of myself and the rest of the Unified Command, bravo to all of our amazing public health nurses that helped us get through this. So thank you very much, everybody, for participating in that poll. I wanted to throw this next slide up, and many of you have seen these slides. They're the slides we talk off of in our morning operational briefings that we have been doing since the beginning of this. So this next part is our expanded operations organization for the state's unified command. So, excuse me. So as you can see on this particular slide, there are a lot of different agencies represented here, not just the Division of Homeland Security and Emergency Management. And I don't know, I think our operations section chief was going to join us at some point, and if he does, he's dealing with some tactics on the Johnson & Johnson vaccine issue this morning. But
Yeah,
if Mark,
Brian.
oh, hey, Mark's here. So I wanted to introduce everybody to Mark Roberts. Mark has been with our division for a very long time. He is the State Emergency Operations Center manager and either serves as an operations section chief or incident commander in the state EOC. So for the pandemic response, Mark has served as our sole operations section chief to manage, herd the cats and manage that. And what's typical of an incident management organization when they start activating, standing up and responding to a particular threat or hazard or event is a lot of conversation between the operations section chief and incident commander to figure out exactly how the organization should be put into place to most effectively achieve the objectives that the unified commanders and the agency administrators have, to solve the problem. So I'll let Mark talk just a little bit here about how he was able to come up with this organization working with our partners at Public Safety, Health, and the Department of Environmental Conservation. So if you had a few minutes, Mark, I'd appreciate it.
Glad to. The key thing to note here is it's just like the unified command is unified, while the operations has one operations section chief and a deputy. All functions inside the operation are represented by the agencies in the state, volunteer, faith-based, other organizations together working on the response. The other key thing to note, I think, is that once the president declared, we kind of established a virtual unified command, at least a virtual ops section chief with the Federal Emergency Management Agency in Bethel, FEMA Region 10. So we were in contact with them. A number of the mission assignments for federal agencies, as well as the federal reimbursement, take place through the Federal Emergency Management Agency. While there's been very little active response on the ground from FEMA in the state, their financing and authority to execute orders for federal partners, including Title 10, which we really haven't used, but our National Guard partners under Title 32 status has been really important. I think the key thing to note is that this is the organization with the addition of the medical branch being beefed up that we used during the earthquake in 2018 of November and during our floods. We just add organizational structure and staff to meet the need. I will tell you that not having expertise in medical, the medical branch has been excellent. It's run by the Health Emergency Response Organization Chief Brian Ritchie, who's been the medical branch director, and has sections for laboratory, public health, epidemiology, medical countermeasures, and vaccine management and distribution. But under those boxes are hundreds, literally hundreds of people in the medical branch that are working. Likewise, in some of the other boxes, there's maybe a dozen people responding in the community response branch, because frankly, while we had COVID going on, we still had volcanoes erupting, earthquakes, communities flooding, communities with power disruption and infrastructure loss. And so I had to respond to those as well. And so we had a community response group. The mass care group has also been key. They responded very effectively to all the feeding support needs in the COVID response, and then transitioned and assisted the Southeast communities during the very large flooding and landslide event in December of 2020 during the state disaster. I think that about covers it. I can answer any questions, Brian, or anything else you want me to highlight.
Thanks for that, Mark. I really appreciate you jumping on in the middle of the response here. And I did want to mention, I just took a look at the chat while Mark was talking, and Heidi Hedberg, the Director of Public Health, and one of my fellow incident commanders for this response is on right now. One of the tenets of the incident command system is, kind of span of control. That really one individual shouldn't be supervising or overseeing, more than 5 to 7 individuals below them. But what Mark said there, the medical branch, may be under a section and reporting to the Unified Command, but it's really the entire Department of Health and Social Services, and specifically the Division of Public Health, was completely retasked 100%, no matter what their regular job duties were, to this response. And most of them are still 100% dedicated to the response and trying to continue the rest of their mission to make sure that Alaskans are healthy and safe. So it's just been incredible. I know it's been incredible for all of you at the local level. And Heidi, I don't know if you wanted to say a few words, if you're still here. Okay, so we'll move on. So besides our operations organization, which really were the doers that we had an unbelievable amount of work being accomplished by our finance section and our logistics section, working on the financial support for all of you, as well as our organization, and really trying to organize kind of the resource ordering process. And I want to thank the Alaska Emergency Managers Association and Casey Cook and others who got with us kind of midway through this, I guess in the August timeframe, and asked to organize kind of a in the middle of the response hot wash / after action to talk about how the resource request process unfolded for this. We were working with a lot of folks that weren't accustomed to using the incident command system -213 resource request form, the 213 RR. A lot of communities we had never really had to talk to in a response prior to this event to begin with. And then we tried to put in formal mechanisms to allow all of those requests to come to a single point of contact at the Unified Command, to have those shipped over to the medical logisticians and all at the medical branch and at the Department of Health and Social Services. And then obviously an unprecedented global scarcity of resources, everything from PPE to testing materials to vaccine, really an amazing, unprecedented effort. And there were communications challenges. We expect that, and there were throughout this response. So I'd like to throw up the next poll that we have out there for folks to respond to, if we could, please. So to that end, please answer the questions in the poll there. How did you handle your logistics and ordering and procurement at the local government, local business level? There are a number of options there for you to choose. And a few more questions below that. How did you handle mass care and donations and volunteers? There's always those aspects of a response, and we're curious to see, did you take care of that in-house? Did you have partner agencies at the local, regional, or national level that you utilized for that? And how did you manage public information? Always a crucial part of any response. Did you stand up a joint information center? Did you communicate normally? Did you all embrace online platforms, that kind of thing? So give everybody a chance to go through those poll questions there. So, I mean, there was a lot, while you guys are answering the questions, there was a lot for us at the Unified Command that we had to adopt and adjust and adapt to through this. Things like these remote meetings. I can tell you, as an incident commander for a long time at the state level, I was very, very comfortable and accustomed and used to having butts in seats and me being able to look at you eyeball to eyeball in the State Emergency Operations Center when we're responding to a crisis. That is, horrible way to say it, but because it happens all the time in government, but it's the way we always did it. And I was very comfortable with that. We were organized that way initially. and it helped facilitate communications. And then, you know, very, very abruptly, we all had to move to working from home and teleworking and trying to use Microsoft Teams or Zoom or WebEx, all of those different conferencing tools that were out there. And I could say it was a challenge for me initially to be able to do that. I think it was a challenge for our section chiefs and supervisors to make sure that they were able to, you know, adjust and make sure that they were taking care of the people that were reporting to them and doing it from this, you know, it wasn't like you can pull them aside into the break room and have a one-on-one to gauge their pulse. So I want to thank Mike Drummond, our safety officer, and all of our section chiefs for how hard they worked to make sure that the staff was taken care of while we had some unbelievable demands of their time and ever-changing information, and all trying to figure out how to do it locally. Our IT organization, both at the Department of Administration and internally in our agency, you know, really had to adjust to try to field laptops and things like that to the rest of our agencies, so they were able to continue work safely in a telework environment. So, looking at the poll results, and again, thank you for participating in those. A lot of folks have about, you know, more than half had said single point ordering through a community EOC to the Emergency Operations Center to the State Emergency Operations Center. That was a challenge in a number of communities who were just not accustomed to working with their borough or their city to order things. You know, we rapidly had to adjust from regular supply chain channels and ordering things through the McKessons of the world and other pharmacy medical supply companies to having to get it from the state because they were the only ones that had access to those scarce resources. So a lot of that happened. A lot of direct procurement, orders sent to regional health organizations. That was another dynamic that not only did we have community emergency operations centers open, but all of our amazing tribal health organizations also answered the call, stood up, and were trying to support both medical advice and information as well as resource requesting. And establishing about 46%, 13 folks have said that they established a local warehouse for PPE and testing supplies. We certainly had to. I think over the course of this, we burned through, it could have been 5 very, very large warehouses in the Anchorage area, sometimes all 5 at once, trying to accommodate the influx of PPE and testing machines and ventilators and associated medical equipment. So that was a very big lift for us to reconfigure our medical response warehouse prior to the pandemic. Was fairly small. I mean, it had a lot of stuff in it, but it was fairly small, and we rapidly had to expand that. An incredible amount of local community leading the mass care operations, looking at things like sheltering, and through the pandemic, of course, non-congregate sheltering, finding hotel rooms or B&Bs or other ways to house both responders and those who needed sheltering in a distance fashion, so we weren't contributing to, you know, quote unquote super spreader events and all. A lot of that happened, and I hope most people saw that the partnerships you had ahead of time, whether you were planning for annual flooding or wildfires, working with your local food pantries and local community centers, really paid off in this, that you were able to stand up those facilities and resources pretty darn quick to support your residents as we were all trying to learn and understand what happened here. And a lot of community, for the public information side, a lot of social media posting, of course. A lot of information continues to be put on official community websites. I participated in probably hundreds of community meetings via online platforms like Zoom and Teams and WebEx, those kind of things, which was difficult for a lot of elected bodies to adjust to being able to do online meetings, public meetings for community councils or assemblies, and interact with the public in that format. And then kind of a little bit less in terms of the kind of old school ways, traditional community press releases. Good to see about 36% did stand up a joint information center to make sure that your messaging at the local level was put out together in a unified fashion to support your response to the organization there. So at the end here, before we jump into questions and two-way conversation, just wanted to throw up our current incident objectives. You know, one of the tenets of the incident command system is management by objectives. So Lieutenant Fussy and Director Hedberg and I continuously reviewing these objectives. Some of them are pretty standard for every event we have. Many are specific to COVID-19. And we're happy to share these. Very important to communicate these to everybody, whether you were in a unified command or a single single agency incident command, making sure that the public understands what we are doing. You know, our job at the state is obviously to support all of you through response ops and resource requesting. And then obviously as we were trying to flatten the curve, to maintain our medical surge capacity to make sure we could take care of those that unfortunately did come down with the COVID disease. So just a little more on our objectives there. So I'm going to stop sharing my screen here so I can see you all, and wanted to turn it over to some question and answers, and hopefully Jeremy and I can go through the chat window here and help try to answer those. Please feel free if you want. I mean, we have a lot of participants, but if you'd like to come off of mute and unmute your video and your microphone to ask questions as well, or provide any real insights that you had from how you built your organization and stood it up, and how you've been able to sustain it for this unbelievable amount of time. So turn it over to the chat, or please come off of video and microphone mute and ask your question.
Hi, Brian. Thanks for your presentation. That was great. So as Brian said, we're going to open it up to questions. Tony Isham had a question in the chat pod. What tribal leadership liaisons did you incorporate or would have been beneficial to have in the future?
Awesome question. I very much appreciate that. And if any of the command and general staff have any additional input, please jump in. So at the state level, we really focused on direct coordination and liaison with the Alaska Native Tribal Health Consortium. You know, they are representatives of, or a conduit for resources and information and all that to the tribal health organizations around the state. And the state's unified command, you know, kind of as that statewide overarching piece, our direct liaison and correspondence was with ANTHC. I can't be more proud than our partnership with Dr. Bob Anders, who is now the leading the Alaska Native Medical Center. Bob was vital to working directly with us and coordinating their needs, and very, very, this has been more complicated and convoluted than anything we've seen before, because we were dealing with CDC and the Federal Health Department and the Indian Health Service and the Bureau of Indian Affairs. And those agencies at the federal level don't always talk to each other. So I feel like we did a fairly good job of being able to collect that holistic glut of resources and information that were coming from disconnected federal agencies and the White House Task Force and all that, and making sure that we were sharing that information at the state level, that we were communicating to our counterparts at Unified Commands and ANTHC and the tribal health organizations like Yukon-Kuskokwim Health, Manilik, Norton Sound, Tanana Chiefs were all communicating with their clinic staff and their constituents to make sure that we were all, kind of heading in the same direction in terms of providing the support and information needed for testing and PPE and treatment of folks that came down with the virus. So at our level, that's what we did. Feel free to throw it into the chat how you did it at the local level. I know there was, as always, there is an incredible amount of cooperation, coordination with our public health nurses and regional and local clinics and then regional tribal health organizations. So it continues to this day. I think you all saw the Alaska COVID-19 task force was co-led by one of our nurse consultants and a representative from the Alaska Native Tribal Health Consortium, just to make sure we were all together in this, making sure kind of unity of effort.
Thanks, Brian. Ms. Amanda Loach with the Municipality of Anchorage asks, what were the best tools to keep the medical branch and the other functions communicating and coordinating effectively?
Thanks, Eva, and thanks, Amanda. I'm glad you're here, Amanda. You know, Anchorage has done a great job through this whole response. You know, I'd say it's positive and negative, but I have been, and probably all of you have been, in absolute meeting hell for over a year. I think my record for virtual meetings was 5 at once. I had 2 Zoom meetings, a Microsoft Teams meeting, WebEx on computers, and then I had a teleconference on my desk phone in the EOC back in the spring. So, I mean, it was amazing. As we were struggling to organize and start communicating effectively up, down, and sideways at the state level, you know, we were accustomed to doing morning operational period briefings, if you will, to let you all know at the local level what we were doing at the state. But trying to organize a gigantic organization, you know, hundreds and hundreds of people from the health department and all of us in emergency management, public safety and response, get those groups first organized and then set up, you know, that quote unquote battle rhythm and meeting schedule. To this day, I had just the other day, I had 12 meetings in 8 hours to participate in, because, and most of it is virtual now, very, very helpful for us to be able to do, you know, to have the chat functionality and share files and share links and all. I think one of our greatest successes on the public information front, led by Jeremy and Elizabeth Manning and our Joint Information Center, was our partnership with the University of Alaska Anchorage and the Center for Human Development and their Project ECHO. We use ECHO as a verb now. We're going to go do an ECHO, which was really a great way for us to reach out to the public, both to have back and forth Q&A for the public and science questions, to have very focused Zoom meetings with large groups of medical providers for palliative care, for dental, for treatment, for pharmacists, all sorts of things, to be able to continue to share that information. And today it is still changing just about every day, the information that we have about this virus and variants and things like that. So I think, unfortunately, many of us who have stood in large incident management organizations over the years, you know, get kind of tired. Nobody wants to go to a planning meeting. They all want to just continue to do their response. And my staff wants to be able to talk to you guys all day, every day, without having to go to meetings. But they're very important to stay organized and an effective way to communicate, to make sure we're all, again, kind of on the same sheet of music. So, you know, we have been and will be in meeting hell for a while, and it's continued. You know, social media platforms, Facebook Live is a huge tool that many communities use to communicate to their residents and constituents on what was going on with local ordinances or local declarations and requirements, when vaccine sites were popping up, that kind of thing.
All right, Brian, we also have a question from John Lee. What lessons were learned on how to manage a prolonged emergency versus the more typical emergencies that are of a shorter duration?
Thank you, John. And I think that may be John Lee from the Division of Senior and Disability Services. I believe John has done an unbelievable job, and his team, in trying to take care of our most vulnerable folks throughout this whole thing. So I couldn't be more proud to have a new friend in partnership with John. The answer to that is we are still learning. None of us ever expected this to happen. We certainly went through the unknown and setting up our medical surge capacity last spring. And I mean, myself included, and a lot of our other emergency managers in our division and operating in the Unified Command thought we were out of the woods. You know, we're used to responding to the flood and throwing sandbags out and evacuating and setting up shelters. And then the floodwaters go away and we start the recovery process. Well, we were all eagerly waiting for that as we began relaxing restrictions in the state moving into the last summer. Director Hedberg from the Unified Command, kind of called this early on that she thought that the severity of this was, kind of going to be a 2-year project. And all of us were like, no, that's not going to be the case. We're going to be in this. We're going to do what we always do as emergency managers: run to the fire and put the wet stuff on the red stuff, and then put the apparatus back in the bay and move on and let the finance folks work on recovery. And that hasn't happened. So it's been a real challenge for us. We do lots of meetings together. Just our division outside of the ICS organization has been not very great at having kind of all staff virtual meetings to do that. But I think the largest success and lesson learned here is that, it almost goes without saying, but our supervisors, our section chiefs and branch directors and group supervisors, division supervisors, all spend an inordinate amount of time one-on-one with the people that they're managing and supervising to do that check-in. Many folks on this call from Abner and Brian Templin and Amanda and others, I had lots of chats throughout the summer with them, just personal chats. We weren't talking a bit about the pandemic. We were talking about our favorite alcohol or the weather or things like that, just to kind of do that quote unquote buddy check to make sure we were all still doing okay mentally and emotionally as we were all responding to this unprecedented thing. I feel like the shorter duration emergencies, even the earthquake in 2018, was easier to deal with because it was a very short timeline where we were at kind of 110% intensity compared to this one. We're still at that level, and I know most of you are as well. And it's tough. And I think there's a lot of fear of the unknown. One of the things about something going on this long is what are we all going to do, and what is it going to look like when we have to go back to normal, back to in-person work, back to being together physically. Like I asked in Jay's last session, things like, are we going to continue telework and all? So there's a little bit of anxiety associated with, kind of a return to normalcy that we're all experiencing. And I think my best advice is that we all need to continue doing what we have been doing, talking to each other as peers, not always talking about work stuff, and just making sure that, we're each all individually and personally healthy and stable to make sure we can continue to lead our communities and our staff as we see an end to this thing, hopefully around the corner.
Thanks, Brian. And leading right into that, Teresa Rosso said that ECHO has been fantastic and that vaccine and public science meetings with experts is very helpful and translated to effective community education. And she thanks everyone for that.
Thanks, Teresa. I couldn't agree more. I mean, it's kind of a running joke on Wednesdays when we're doing our public science ECHO of us on the ECHO team trying to answer every question we get. And I got to tell you, I mean, sometimes we get hundreds of questions in the Q&A to try to answer in, about 50 minutes after Dr. Zink or Dr. McLaughlin do a presentation. So I agree. I haven't seen anything as effective as those ECHOs for us to talk directly to the public and answer their questions, as well as talk to providers about kind of the medical nerdy stuff that, I still can't pronounce some of the words that are out there, but I'm trying.
I have a question, maybe you can answer it quickly, from OEABP. Working from local level to state level has been good. What has the interaction been like working from the state level up to the federal level and working with federal partners?
A dynamic situation. So the Unified Command, all of our agencies were very accustomed to working with folks like CDC and the Department of Health and Human Services, ASPR folks for medical countermeasures, kind of the Strategic National Stockpile. Fits and starts and a little bit of struggles with FEMA being directed across multiple administrations to manage medical countermeasures and medical technology. We were all learning the language and a little bit challenging there, but I would still say I would put our Federal Emergency Management Agency, Region 10, and the Health and Human Services, Region 10, CDC folks against anybody in the nation. We had longstanding relationships prior to the pandemic, and that really helped the level of trust and comfort being able to get all this ever-changing information to the state from the feds. And, know when shipments and trucks of masks and things like that were coming on. So I think that is always the key. Better to know each other and exchange business cards prior to an event. And we have done that with our federal partners. And I think it led a large part of our success working with the federal government through this, because everybody was kind of a known quantity when this thing started.
Awesome. And Lanny and Livingston would also like to thank Jeremy Zidek and Elizabeth Manning and all the other PIOs statewide for the weekly DHS community meetings. They've been very helpful.